The Rome 4 conference convened in Rome, Italy, December 2014 at the Marriott Grand Hotel Flora. 16 committees met over a week-long conference to work on the Rome 4 diagnostic criteria for functional gastrointestinal disorders, set for release in 2016. The committee's members gave of their time, expertise, and talents to accomplish their assigned task.
And we were assigned to review the functional esophageal disorders criteria and see if we want to make any changes in the criteria, in their definition, and possibly see if we need to come up with new criteria or new definitions.
I feel very honored to be on the committee. It's very important work to have the right diagnostic criteria for children and adolescents who suffer from these disorders.
We have worked intensively on the manuscript describing the microenvironment. It was very productive. Everything was well organized here. Good to see everybody of the Rome Foundation, and yeah, I had a great time here.
I was the co-chair of the design of treatment trials this time, and I met some new people. I met some people that I was familiar with from previous Rome committees. We had a wonderful group that interacted very well, and we had a lot of work to do. I think the work we did was very important. I hope it will be important for future clinical trials.
Our committee had a host of responsibilities, which included reviewing all the published literature from the last Rome criteria publication in 2006. And one of our goals was to update the diagnostic criteria for functional bowel disorders, including irritable bowel syndrome, functional constipation, functional diarrhea, and functional bloating and distension.
My first experience with the Rome process has been really rewarding, really excellent. It's been quite hard work, and I think every committee member has put in a huge effort, but it's also been very rewarding because I feel like each of us, certainly myself, I've learned a lot in the process.
And I'm a member of the board of directors and also a member of the Rome 4 committees on design of treatment trials and multicultural aspects. So I'm very proud of being here in Rome and working on this fantastic process of Rome 4.
At the conclusion of the committee's work, there was a harmonization meeting in which suggestions for the Rome 4 criteria were presented and discussed.
At least a 1 week gap between a stereotypic episode is critical for the diagnosis.
Questions? Normal amylase and/or lipase are moved to supportive criteria. Again, patients with biliary SOD occasionally have mild amylase or lipase elevation, generally not 3 times abnormal, but we didn't think we want to rule that out.
I think the fact that we made a separate chapter now reflects the importance that we're beginning to attribute to cross-cultural, geographic, and so on factors, and also to the fact that a large part of our membership and readership are from all over the world.
Notes of this meeting were meticulously recorded and then printed so they could be further studied by all of the Rome contributors. In the final meeting of the committee chairs and co-chairs and the Rome Board of Directors, led by Rome Foundation President Dr. Douglas Drossman, changes and suggestions were discussed which may require additional refinement.
That will help to separate the pain predominance of the IBS from the functional constipation, for sure. That's very different from someone who you flush out their bowel and they still have pain. And that second group is where I might use an antidepressant, where I might not for the other. So I think there is room for categorical aspects in clinical trials, right?
Though there was much work to accomplish in Rome, there was also time for social activities for Rome members and their families. There were guided tours of Roman landmarks. The Colosseum, and other magnificent buildings and churches. A spirit of cooperation and collegiality was shared by all the Rome contributors that will likely become lifelong collaborations and engage health professionals in both clinical medicine and basic science.
I met new people, and I'm new to the Rome community this year, so I don't have the previous experience. But I did meet new people that I know we're going to continue to work together. And I met many people that I knew already that just made everything stronger.
This is really an area for team science, and it takes a wide array of professionals to really explore the etiology, the pathophysiology, and the clinical management to result in those ideal patient outcomes that we're all trying to achieve.
It's really interesting to interact with clinical colleagues because it really gives you a feel for what it is that you're investigating. So, you know, it gives you the patient perspective.
And I found it to be an extraordinarily interesting process and intellectually stimulating process to work with experts from throughout the world on these very prevalent disorders.
This cross-discipline sharing of knowledge will enhance clinical studies and diagnosis and care for all patients suffering from gastrointestinal disorders. The meeting in Rome for the Rome 4 book is part of many educational and research activities promoted by the Rome Foundation, which is headed by a multinational board of directors. Here are all of the conference participants. Please visit our website at romecriteria.org. Thank you.